Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Macrocephaly. In macrocephaly, the head circumference is more than 2 standard deviation from the expected. Causes of macrocephaly are there is hydrocephalus. In hydrocephalus, large head is due to the large ventricles where there is increased cerebrospinal fluid pressure. Hydrancephaly. In hydrancephaly, the cerebral hemispheres are absent and they are replaced by sacs which are containing cerebrospinal fluid under increased cerebrospinal fluid pressure. In hydrancephaly, midbrain and brainstem are normal. The midbrain and brainstem are normal at birth, and progressively in hydrancephaly there is normal, the baby is normal at birth, and there is progressively increase in head size along with the seizures. Then there are hemorrhages in the brain also results in macrocephaly. Two else, that is lysosomal storage disorders like Tay-Sachs disease, Saunders disease and mucopolysaccharidosis will present with macrocephaly, whereas leukodystrophies like Alexander disease and Canavan disease also present with macrocephaly. Neurocutaneous syndromes like neurofibromatosis most commonly and tuberous sclerosis also presents with macrocephaly, whereas Soto's syndrome will show overgrowth syndrome also. In Soto's syndrome, there is mutation of NSD1 gene on chromosome 5, and thus in Soto's syndrome you will see that there is increase in height and increase in head circumference is seen, and lower limb difficulties are also important in Soto's syndrome. Soto's syndrome is also called as cerebral gigantism. Then the Fragile X syndrome also presents with macrocephaly.
thank you and thank you for watching.